Class number 5 of the course of Axial Anatomy number 1 for sonographers of Florida National University. Peritoneum. Peritoneum is a serous membrane, exactly like pericardium, same as pleuras. We're talking about pericardium, we're talking about pleuras that always are a double membrane that cover the internal cavities. One is called parietal because it's in the wall of the cavity, other is called visceral because it's covering the organs that are inside the cavity. Peritoneum is the serous membrane of the abdominal cavity and is the most important for us because sonographers working more in the abdominal cavity than the thoracic cavity, with the exception of pericardium and pericarditis and pleural effusion. The peritoneum is more important serous membrane of the body for sonographers. The peritoneum have two functions: support the abdominal organ and also the vessels, the nerves that going to the tissue of the organ go through a part of the peritoneum that is called mesenterium. Mesenterium anchor the organs, and mesenterium also is the area where vessels and nerve going to the tissue of the organs. Layers, exactly like other serous membrane, the peritoneum have two layers. The outer layer is the parietal peritoneum and the inner layer is the visceral peritoneum, and between the two layers is the abdominal, the peritoneal cavity. The peritoneal cavity is a space that is empty, only have a little quantity of fluid to let the organ moving inside the abdominal cavity. The outer is parietal and the inner is visceral. But remember that is the same that reflect the peritoneal parietal peritoneum is the same visceral peritoneum. You can see here visceral peritoneum, parietal peritoneum, and in the middle the peritoneal cavity that is near empty, only a little quantity of fluid when the person have no pathology. But when the person have a peritoneal effusion, this is called ascites. Ascites is very important for sonographer and is very easy to detect with ultrasound. Ascites is fluid between the parietal and visceral layer of the peritoneal cavity, exactly like pleural effusion when is in the lungs, or pericarditis when is the pericardium. Parietal peritoneum is attached to the abdominal wall. This is the posterior parietal peritoneum because the anterior parietal peritoneum is in the wall that is not in this image. Parietal peritoneum covers the walls of the peritoneal cavity or the abdominopelvic cavity. Visceral peritoneum is wrapped around the internal organs. The potential space between the parietal and parietal peritoneum and the visceral peritoneum is filled with a small quantity of fluid. It's called serous fluid. Twofold are primary importance in the peritoneum. One is called the omentum and other is called the mesentery. The omentum is like an apron that have circulatory and antibacterial defense functions, and the mesentery anchor the organs like the bowel in this moment, and also is the part that the vessels, the arteries and the vein that coming from the organ go through. The mesentery anchor the organ to the posterior wall, but also let arteries, vein and nerves go through. Omentum, an apron-like flap of tissue hang in front of the stomach and intestine. This is not very important for ultrasound, but also you can visualize omentums and mesentery when the person have ascites. But if the person has no ascites, there are organs that even we know are there are not easy to see with ultrasound, because you know the abdomen and the bowel specifically have a lot of gas. The greater omentum is given off from the greater curvature of the stomach for the large sheet that lie over the intestine. This is something that only you can see when you open the patient. You have one example here, very good example. What is the omentum? Omenta are abdominal structure formed from peritoneum and structural similar to mesentery. But mesentery are exactly the same, but mesentery are around the bowel and the organs. Mesentery attach the small intestine and much of the large intestine to the posterior abdominal wall. This is the mesentery, this area that is here around the bowel. This area anchor the bowel and the colon, and also let the arteries and nerves go through. The term mesentery is often used to refer to a double layer, exactly like pleura, exactly like pericardium of visceral peritoneum. You can see here the mesentery, two-fold of peritoneum. It's not different. It's a two-fold of visceral peritoneum. Here are often blood vessel, nerve and other structures like lymphatic that go through the mesentery. Mesenterium is very important to recognize when you are doing procedures inside the abdominal cavity, when there are ascites, to take the fluid away. Paracentesis. Paracentesis is the procedure helped with ultrasound to get the fluid that is inside the peritoneal cavity. To get this, is very important to recognize mesentery and to avoid to put the needle through the mesentery. We are going to talking about the abdominal aorta. The abdominal aorta is the principal artery of the abdominal cavity. It's the artery that are going to give branch to other organs, and it's the artery that also give branch to the lower limbs, pelvic cavity and lower limb. It's very important for the sonographer to understand and to recognize all the arteries of the aorta, and also the principal arteries of the aorta, the arteries that you can see with ultrasound, but even the arteries that you cannot see with ultrasound are important too. Abdominal aorta begin at the diaphragm and finish in the bifurcation, begin at the level of the diaphragm when the aorta go through the diaphragm, and finish when the aorta bifurcate in the two common iliac arteries. Run parallel to the vertebral column is a landmark. If you see the aorta, you also know where is the vertebral column, and vice versa. you can see the first important branch of the abdominal aorta is not easy to see with ultrasound and is called inferior phrenic artery. Sometimes in the test they asking about the inferior phrenic artery, but there are very little not for ultrasound. But to the beginning with the arteries of the aorta abdominal that you can see with ultrasound, the first and very important is the celiac trunk. The celiac trunk give other branch. The most important branch of the celiac trunk are three: the hepatic artery or common hepatic artery, the splenic artery that go to the spleen but give a lot of branch, and the left gastric artery. This is the three branch. This structure in ultrasound is not always easy to see, but is a very good landmark, and they call the seagull because look like a bird. The hepatic artery and the splenic artery produce a picture that sometimes is similar to a bird. This second branch is very important, and its other landmark is the superior mesenteric artery, very important artery that gives blood to the bowel. The superior mesenteric artery is easy to recognize because the walls are echogenic. In other words, in the screen, the walls of the superior mesenteric artery are hyperechoic. There are continuously two very important branches, the right renal artery and the left renal artery. Sometimes this artery have little branch for the suprarenal, but are not very important. I want you to remember the right renal artery and the left renal artery that are big and important. After this coming two little arteries are called gonadals. Gonadals are different in male and female. In the male have the name of testicular arteries. In the female are the ovarian arteries. Are two not easy to see with ultrasound, and the last one important that is not always easy to localize with ultrasound is the inferior mesenteric artery, an artery that gives blood to the distal part of the colon. Colon sigmoid, distal part of the colon, and some part of the transverse colon. When they make an anastomosis, a branch of the inferior mesenteric artery make an anastomosis with a branch of the superior mesenteric artery. After this, the bifurcation. In the bifurcation, we have the right common iliac artery and the left common iliac artery. In other words, the aorta for sonographer begin with the celiac trunk and finish at the level of the bifurcation of the aorta, where there are the two iliac common arteries. To review: celiac trunk, superior mesenteric artery, right renal artery, left renal artery, the two gonadals, not to ultrasound, the inferior mesenteric artery, not easy with ultrasound, and the bifurcation in right and left common iliac arteries. Visceral arteries of the aorta. The first branch that you can see with ultrasound is the celiac trunk. The celiac trunk have branch left gastric, splenic, and common hepatic artery. The superior mesenteric artery is the artery that gives blood to the bowel, to the ascending colon, and to the half of the transverse colon. Very important artery, very important landmark. The walls are very, very echogenic, are hyperechoic in the transverse of the aorta, and this is a very good landmark. Middle suprarenal, not important. Arteries not possible to see commonly with ultrasound. Renal arteries, very important in ultrasound. There are special studies of the renal arteries for hypertension. Gonadal artery, not easy to see with ultrasound, not in the aorta. You can see the testicular artery and you can see the ovary artery sometimes when you see the testicle of the aorta, but or the testicle or the ovaries, but really are not very common arteries in ultrasound. And the inferior mesenteric artery, that also is not easy to see with ultrasound. You can see here to review celiac trunk, the first branch that you can see with ultrasound, and the three branch, the hepatic artery, the splenic artery, and the left gastric artery. The hepatic artery and the splenic artery give the shape of a beard that you can see in the ultrasound when you are scanning transverse the proximal part of the aorta. The second branch is the superior mesenteric artery. It's easy to detect with ultrasound because the walls are hyperechoic. Other important arteries that are inferior to the superior mesenteric artery are the right renal artery and the left renal artery. Gonadal artery, testicular in male, ovarian in female, are little not easy to see with ultrasound, and the same happen with the inferior mesenteric artery, not easy to detect with ultrasound. And this is the bifurcation in the right iliac and the left iliac. Right common iliac artery and left common iliac artery is the correct name. Celiac trunk, superior mesenteric artery, right renal, left renal, right gonadal, left gonadal, inferior mesenteric artery, and the bifurcation in the right common iliac artery and the left common iliac artery. This is not difficult to remember, but it's very important. If you are going to work in one hospital, you need to know this graphic perfectly. You must understand the abdominal aorta because you are going to talking about this with the radiologist, and the protocol of the aorta is a very common protocol. It's called abdominal aortic aneurysm. Is because this is a very common disease. Aorta is an important organ, is also an important landmark, and have a very common protocol. You can see the picture in sagittal because the aorta is long in sagittal, and you have here this one. This is the superior mesenteric artery, and this little one here is the celiac trunk. This is the liver here, and a little part of the pancreas here. But remember, superior mesenteric artery, celiac trunk. You have here one example of an ultrasound picture of a aortic aneurysm. Abdominal aortic aneurysm is a dilatation of the aorta and is very common disease and also a very common protocol. You can see here a ultrasound picture in transverse with the mixture of one aneurysm. You can see here 4.9 is a big aneurysm. Is one aneurysm of the aorta have more than 6 centimeters, the patient must remain in the hospital. It's very dangerous when the aneurysm or dilatation of the aorta measure more than 6 centimeters and is mandatory. The patient must remain in the hospital for the treatment. It's very dangerous, are so big. Celiac trunk. In the picture is a CT scan of the celiac trunk. I know it's a CT scan because it's wide. Remember that the arteries and veins in ultrasound are anechoic, are dark. In CT scan, the arteries are wide. The celiac artery supply oxygenated blood to a lot of organs: liver, stomach, abdominal, esophagus, spleen, and superior half of both duodenum and the pancreas. The celiac trunk have a lot of branch, have 3 branch, but the branch of the hepatic artery and the branch of the gastric artery and the branch of the splenic artery give blood to different organs. You can see here the CT scan of the celiac trunk. Celiac trunk, splenic artery, and the common hepatic artery. This is CT scan. This is not ultrasound. You can see here a ultrasound with the aorta, the celiac trunk, and the hepatic artery to the right side of the patient, and a splenic artery to the left side. This is for that the bird shape that they call the seagull. You have other picture here. Here the aorta, celiac trunk, superior mesenteric artery, liver here, and a little part of the pancreas. Vertebral column, always posterior to the aorta. Remember the orientation: anterior, posterior, superior, and inferior. Superior mesenteric artery supply the intestine from the lower part of the duodenum to the left colic flexure. In other words, bowel, ascending colon, and transverse colon. Very important artery. Middle suprarenal are not important arteries in ultrasound, are not common to try to scan the middle suprarenal. Are 2 small vessels which arise, one from either side of the abdominal aorta, sometimes coming directly from the renal arteries. Not easy to see, not important in ultrasound, only to remember that there are 2 arteries that are called suprarenal arteries. Renal arteries are very important for ultrasound and are a very common question because the renal artery, the right renal artery, is the only artery that goes posterior to the IVC. The only artery in the body that goes posterior to the inferior vena cava is the right renal artery. Of the contrary, the left renal vein is the only vein in the body that goes anterior to the aorta. You can see here, right renal artery, posterior to the IVC, left renal vein, anterior to the aorta. Typical question. The right renal artery is the only artery in the body that goes posterior to the inferior vena cava. Right renal artery, left renal artery. Important in ultrasound, not easy to scan, but give very important information in some case of hypertension. Sometimes Hypertension is caused because there are stenosis in the renal artery. This is a CT scan of the renal arteries. Inferior mesenteric artery supply the large intestine from the left colic flexure to the upper part of the rectum and make an anastomosis, a branch of the inferior mesenteric artery connect with the superior mesenteric artery and make an anastomosis, a communication between two arteries. Here is the superior mesenteric artery. Here is the inferior mesenteric artery to the descending colon and the sigmoid colon, and here is the anastomosis between the inferior and the superior mesenteric arteries. Anastomosis is when two arteries coming together. Anastomosis of the inferior and the superior mesenteric arteries. This is the inferior mesenteric artery that give blood to the descending colon, sigmoid colon, and the superior mesenteric artery give blood to the other part of the colon and the bowel. Okay, we finish with arteries. We are going to see something very important in the abdomen, and is how the blood of the digestive system go to the liver to be cleaned before re-entering in the normal circulation. All the blood from the stomach, bowel, and other organ of the digestive system need to be cleaned before re-entering in the inferior vena cava. That not happen with the kidneys. That not happen with other organs. Only the digestive organs that are in the abdomen put the blood in the liver to be cleaned before re-entering the inferior vena cava. The superior mesenteric vein drain blood from the small intestine. Of course, it is superior mesenteric artery give blood to the small intestine. The superior mesenteric vein take the blood without oxygen that coming from the bowel. The superior mesenteric vein at its termination behind the neck of the pancreas. The superior mesenteric vein combined with the splenic vein that bring blood to the spleen to form the portal vein. The portal vein is very important in sonography. It's easy to detect and is a vein that is very particular because it's a vein that give blood. The portal vein give blood to the liver to be cleaned, and the portal vein is formed by the union of the superior mesenteric vein and the splenic vein. You can hear here superior mesenteric vein together with the splenic vein for the portal vein that give blood to the liver. And this is not normal because the organ take the blood from arteries, but liver take the blood from a vein, the portal vein. A splenic vein, a vein formed by the union of several small veins that return blood from the stomach, pancreas, inferior mesenteric vein, and spleen. The splenic vein together with the superior mesenteric vein form the portal vein. The portal vein gives blood to the liver. You have the picture here. This is the confluence, very important landmark. The confluence is formed by the superior mesenteric vein and this little part that is the splenic vein. But the confluence is very important also because it's the landmark to study the pancreas. If you want to show the pancreas to the doctor, you must show the confluence. Other landmark here, the superior mesenteric artery, the aorta, the inferior vena cava, and interesting here, the left renal vein, the only vein in the body that courses anterior to the aorta and course between the superior mesenteric artery and the aortic artery. Left renal vein, the only vein in the body that courses anterior to the aorta. You here have the splenic vein. Inferior mesenteric vein do not finish in the portal vein. Inferior mesenteric vein finish in the splenic vein. Is the vein that have the blood that coming from the ascending colon and sigmoid colon. Is a blood vessel that drain blood from the large intestine. Not all the large intestine, only descending colon. Inferior mesenteric vein finish in the splenic vein. Splenic vein finish in the confluence, as also finish the superior mesenteric vein, and in the confluence is the beginning of the portal vein. The portal vein that is easy to scan is the vessel that gives blood to the liver. Portal vein, very important in ultrasound, is a atypical vein, is a vein that gives blood. The portal vein carries blood from the digestive tract to the liver and is formed by the splenic vein and the superior mesenteric vein here, where is the confluence. Confluence is a very important landmark for the pancreas, and confluence is also the beginning of the portal vein. You have here the portal vein from the confluence to the liver. From the confluence to the liver is the portal vein. Not very long, but very important. You have here a color Doppler picture of the portal vein. Portal vein here with a spectral Doppler. You have here other illustration of the portal vein, a splenic vein, superior mesenteric vein, confluence, portal vein inside the liver, entering in the liver. Other picture of the same. Superior mesenteric vein, splenic vein, behind the pancreas, posterior to the pancreas, for the portal vein that finish in the liver. Confluence, the union of the splenic vein and the superior mesenteric vein and the beginning of the portal vein. Confluence, important landmark for the pancreas, is the union of the splenic vein with the superior mesenteric vein. Aorta, IVC, superior mesenteric artery, left renal vein anterior to the aorta. Other picture, superior mesenteric vein, splenic vein, inferior mesenteric vein, finish in the splenic vein, and the portal vein. The portal vein begin in the confluence and finish in the liver. Hepatic veins are normal veins. Hepatic veins are the veins that put the blood after pass through the liver to the inferior vena cava to enter in the normal circulation. Remember, all the blood that coming from the digestive system need to be cleaned before re-entering in the inferior vena cava, and the hepatic veins are the veins that take the blood from the liver and put in the inferior vena cava. There are three hepatic veins: the right, the middle, and the left hepatic vein. Any of the veins that carry from the liver the blood collected from the hepatic artery and portal vein, and that terminate in the inferior vena cava. Hepatic veins: right hepatic vein, middle hepatic vein, left hepatic vein. You can see here the hyperechoic landmark, the diaphragm. Renal veins are not as the portal vein. Renal veins are common veins that finish in the inferior vena cava. Renal veins are coming from the kidneys. The kidneys are not part of the digestive system. Only the blood of the digestive system need to go to the liver to be cleaned. The renal vein put the blood in the inferior vena cava. The other curious thing of the renal vein is the left renal vein is the only vein that course anterior to the aorta. More than this, course between the superior mesenteric artery and the aorta, the left renal vein. You have here the right and the left renal vein. This is the left renal vein, the only vein that course anterior to the aorta, course between the superior mesenteric artery, this one that coming here, and the aorta. Between the superior mesenteric artery and the aorta go through the left renal vein. I am going to use this graphic in the test. I want you to recognize not the right or the left. I want you to recognize the hepatic veins. I want you to recognize the inferior vena cava, the portal vein, the superior mesenteric vein, the splenic vein, and the inferior mesenteric vein. This is a graphic for vessels. This is a graphic for veins. I am not interested in the descending or the ascending column of the liver. I want you to recognize the inferior vena cava. I want you to recognize the hepatic veins, the portal vein, the inferior mesenteric vein, the superior mesenteric vein, the inferior mesenteric vein, and the splenic vein. I don't need the colon in this picture. I don't need the liver. Only veins. Common disease of the peritoneum: ascites. Ascites is a disease, is free fluid in the peritoneal cavity. Very easy to see with ultrasound when it's big. When it's little, there are some places that are more common for peritoneal fluid or ascites. Pneumoperitoneum, this is gas in the peritoneal cavity, not for ultrasound. Remember, gas is not the best for ultrasound. And peritonitis, even is a very important disease. Ultrasound is limited to diagnosis the presence of peritonitis. Ascites, this is a dramatic picture of a patient with free fluid in the abdominal cavity. It's an accumulation of excess of fluid with the peritoneal cavity. Other ascites here in a female patient, accumulation of fluid in the peritoneal cavity. The majority etiology, the most common etiology is the hepatic cirrhosis, but it's not the only one. You can see here the right kidney, and between the right kidney and the liver is free fluid. This free fluid is in a very important area that is called the Morrison pouch. The Morrison pouch can detect free fluid even when the quantity is not as big as the patient that we see in the pictures. Morrison pouch is very important in ultrasound and is one part of the body where fluid in the peritoneal cavity accumulate when there are not a big quantity yet. You have here ascites in a liver with cirrhosis. This is a typical liver with cirrhosis. The texture, the size of the liver is little because cirrhosis produce little livers, and this is anechoic. This is free fluid. Free fluid in the peritoneal cavity is called ascites. Other example of ascites in the abdominal cavity. Remember, free fluid is anechoic. Cause of ascites, the principal cause of ascites is the portal hypertension, and the principal etiology of portal hypertension is cirrhosis of the liver. Other cause, neoplasms or tumors, hypoalbuminemia, that is little quantity of albumina in blood, also can produce ascites, and there are other causes, but the most important cause of ascites is the portal hypertension, and portal hypertension occurs when the blood cannot pass through the liver and accumulate in the portal vein and in the superior mesenteric vein, the splenic vein, all the arteries that give blood to the portal vein will be affected. There are an elevation of the pressure in the portal vein and in the vein that give blood to the portal vein. Portal hypertension, you can see the picture of the portal hypertension, very big ascites with collateral veins. The vein cannot go through the liver and taking collateral veins. Increase in blood pressure in the vein of the portal system. Portal system is the portal vein, is the splenic vein, is also the superior mesenteric vein, caused by obstruction in the liver, causing enlargement of the spleen, called splenomegaly, and collateral veins. The principal cause of portal hypertension is the cirrhosis of the liver, but also the congestive heart failure is also can produce free fluid in the abdominal cavity. Constrictive pericarditis, because produce a congestive heart failure, also can produce. And the Budd-Chiari syndrome, that is the obstruction of the hepatic vein in the inferior vena cava. But this is not very common. Cirrhosis of the liver is the most common cause of portal hypertension. The blood accumulates in the portal system because cannot pass through the liver. You can see an illustration of a cirrhotic liver and a normal liver. In the cirrhotic liver, the blood cannot go through the liver, accumulate in the portal vein and of course in the portal system. One picture of a liver with cirrhosis, the border is very irregular, the liver half is little, and there are here free fluid, coarse texture, an irregular border, liver cirrhosis, easy to see with ultrasound. This is the procedure to close the portal vein and to connect the portal vein directly with the IVC. No more in use. Budd-Chiari syndrome is an uncommon condition induced by thrombotic or not thrombotic obstruction on the hepatic venous outflow. Non-thrombotic is in general produced by a tumor. You can see here a clot. This is a clot inside a hepatic vein. It's a Budd-Chiari syndrome. Cause of ascites, tumor, cancers. Benign tumor or malignant tumor can produce a lot of free fluid that accumulate in the peritoneal cavity. Malignant ascites is the manifestation of the end-stage event in a variety of cancer and associated with poor prognosis. When you take the fluid that is inside the peritoneal cavity and the pathologist study, find a lot of cancer cells. Malignant ascites, poor prognosis. The common cancer was ovarian following gastrointestinal cancer. When there are free fluid in the peritoneal cavity and there are not signs of liver cirrhosis, it's logical to think in ovarian or gastric cancer. You can see here a ovarian cancer, irregular border, inhomogeneous with free fluid. This is typical. Cancers in general have irregular borders and irregular texture, and typical are sometimes accompanied by the production of free fluid. Remember, free fluid always is anechoic. Meigs syndrome is a special syndrome of a benign ovarian tumor, ascites, and pleural effusion. The peritoneal cavity and the pleural cavity have communication. Sometimes if you have free fluid in the peritoneal cavity, the free fluid also can move into the pleural cavity. Meigs syndrome. Pneumoperitoneum, gas inside the peritoneum. No for ultrasound, for X-rays. You can see here in X-ray the diaphragm, and between the diaphragm and the liver, one dark space produced by the presence of air. This is diaphragm, this is the liver, and this part is gas between the diaphragm and the liver. This is not normal. It's not normal to have air in the peritoneal cavity. In the peritoneal cavity, normally only a little quantity of fluid. What produces this pathology? Sometimes traumatism, sometimes perforation of gastric ulcers. Peritonitis is the infection of the peritoneal cavity, inflammation of the peritoneal lining or cavity, as may occur with either perforation or infection. A very common cause of peritonitis is appendicitis. Appendicitis, when the appendix blow out, can produce peritonitis. And the end, thank you very much.